Good afternoon, everyone. I'm Vincent Strelli Jr., the CEO and founder of the New England Center for Children. Today, we're very pleased to welcome back Governor Baker, but it is his first visit since becoming governor, but his second visit overall. Lieutenant Governor Polito, who we had the pleasure of hosting last fall, is here for the second time, and Secretary Sutters, who I first met in 1981 as a newly minted social worker who was here on a referral and has been here countless times since. Additionally, John Kim, the chairman of our board of directors, is here today, and he's also a major supporter of the center. And Elizabeth Becker, the executive director of the Massachusetts Association of Approved Private Schools, is here representing the 81 members of the MAPS community, many of whom were have been beneficiaries of the support we've received throughout the pandemic from the governor and the coronavirus task force led by Secretary Sutters. The New England Center is an award-winning autism education and research organization that has provided services to the children of the Commonwealth without interruption for 45 years. We focus on maximizing student independence through a variety of programs in school settings, as well as our ACE software application, which serves over 7,000 students with autism every day, providing their programming, including 2,900 students across the Commonwealth. Center's always proud of the hundreds of teachers, literally, who trained here, graduated from our on-site master's programs, and now serve in the public schools across the Commonwealth. Like many schools throughout the state, our school was greatly impacted by COVID-19 pandemic. The governor's original state of emergency declaration included our teachers as essential service workers. Thanks to the Baker administration's commitment to serving the Commonwealth's most challenging students, we were able to keep our residential program open throughout the pandemic. We'd like to thank Governor Baker and his administration for providing the center with in-house testing and for helping us source much-needed protective equipment. It's important to note that our 121 residential students have no alternative to the New England Center for Children and cannot live safely at home, and some do not have a home. Secretary Sutters and the administration understood this at the start of the pandemic and provided us the help we needed to succeed. We successfully contained the virus, and as of this moment, we do not have any staff or students that are currently COVID positive. And we have not had any positive student cases for the last 7 weeks. We also salute our 900 employees, many of whom bravely served our students this winter, even when some tested positive. The fight against COVID is far from over and has brought unexpected financial strain to our schools and many Chapter 766 schools. The ongoing costs associated with PPE, hazard pay, additional cleanings, and major facility-related changes will not be going away. On behalf of the New England Center, I want to thank Governor Baker and the Coronavirus Task Force, led by Secretary Sutters, for their ongoing support of the residential programs for our children with autism and other special needs. We spent more than $3 million unbudgeted from our own savings in order to succeed to contain this virus. The announcement coming today is an enormous help to all of us, and we deeply appreciate it. I want to thank you all and welcome our Governor, Charlie Baker. Governor.
We gave you a spot over there, Vinny, if you want one. Yeah, that's always a question, yeah. Well, thank you very much, Vinny, and thanks for the chance to visit today. And I want to say thank you especially to all the folks who are here who are part of this community and have weathered, in many respects, the storm of the past few months with grace and kindness, both to each other and to the folks that you serve. We're here today to make an announcement with respect to programs like this and others around the Commonwealth. But before I go there, I do need to give my daily update on the COVID-19 statistics. Yesterday, the state reported that over 11,000 individuals were tested for COVID-19. In total, about 1.2 million tests have been administered to date. Yesterday, there were 172 new positive cases reported. That brings the statewide total of positive tests to 105,629. The 7-day average for the positive test rate remains at about 1.7%. That positive test rate has dropped by 94% since the middle of April. We saw similar numbers overall across the weekend with respect to hospitalizations. There are currently 583 patients who are hospitalized for COVID-19 statewide, and 93 of those are in the ICU. The three-day average of patients in the hospital is down by about 85% since the middle of April, and as of yesterday, 2 hospitals were operating in surge capacity, but it was not related to COVID, it was related to other issues, if I'm reading the report correctly. Yeah. We obviously remain focused on these metrics as we continue to contain and fight COVID and work to gradually reopen the Commonwealth. Today, Boston will start phase 3 in the city of Boston. With more activity, we'll continue to work with them to urge residents everywhere to continue to be mindful and vigilant. It's only because of the hard work and the commitment and the diligence and dedication that so many people here in the Commonwealth have put into their individual opportunity to stop the spread that in many ways we've been successful. Wear face coverings when you're indoors or when you can't socially distance, practice good hygiene and hand washing, stay home if you're feeling sick, and contact your healthcare provider if you experience symptoms. We're very glad that so many people over the course of the past 120 days or so have taken advantage of telehealth. It's turned out to be a terrific way for people to stay in touch with their providers on a regular basis over the course of the past several months without having to engage in face-to-face contact. I think in many ways that is one of the most positive developments of this whole ordeal, and I certainly hope that we continue to have telehealth available to people as we go forward. I'll close just by saying on this particular part that COVID is not going to take the summer off, and our success in slowing the spread and containing the virus will continue to depend on the efforts of all the residents here in Massachusetts who have been so terrific in stepping up and dealing with this over the course of the past several months. I do also want to say that our success on the reopening piece will be driven in many ways by compliance with the workforce safety standards that have been developed by Lieutenant Governor Polito, the Reopening Advisory Board, and so many of our colleagues here in Massachusetts in the public health and healthcare space. We're grateful that thousands of businesses and organizations are doing their part to implement the reopening guidance that's been made available. People are working hard to cooperate and be creative. But if folks believe that a business or an employer is not observing the safety guidelines, we've set up a process for people of the public or employees to reach out and communicate that. Today we're launching a new website, mass.gov/compliance, to provide easy access to the tools that you need to submit a report of noncompliance. Starting today, callers to the state's 211 COVID-19 hotline can report issues that will be directly moved to this webpage. Investigations can result in enforcement measures if violations are discovered. Just want to say again that we know everybody's working hard to be safe and create the best new normal we can with COVID-19, and we are deeply grateful for the cooperation of our employer community and so many others, and we hope this tool can help promote accountability as we continue to reopen Massachusetts. Now, with respect to today's announcement, it's related specifically to our special education residential school providers who have stepped up in a big way over the course of the past several months. We're here today at the New England Center for Children for just that reason. The Commonwealth's special education residential schools do tremendous work educating and supporting students with special needs. Throughout the pandemic, special education residential schools like this one have remained open. Again, I want to thank Vinny and the team and so many of the folks who operate in this community for the work that you've done to ensure that kids continue to be served during extremely difficult circumstances. The ability this community has shown to adapt, to maintain a safe environment for students in their care and for their 24/7 staff has been a godsend. Now, schools incurred unanticipated costs that were related to the purchase of personal protective equipment, infection control measures, increased staffing costs, and enhanced cleaning protocols over that period. We know this was difficult work, and we know that so many people, time and time again, found a way to simply get it done. The virus has caused changes in respect to everyone's existing routines, and we know that these changes have been particularly disruptive for individuals with special needs and particularly stressful for their families. Today we're announcing a $16.1 million relief package for 32 special education residential school providers to support costs that are related to COVID-19. The New England Center for Children, for example, will receive almost $2 million of this funding. Earlier in the response to the COVID-19 pandemic, the Executive Office of Health and Human Services authorized $139 million in funding for residential and congregate care service providers. Those funds were used to increase staffing, enhance infection control procedures, and purchase and acquire personal protective equipment. Due to the structure of the special education residential schools, for a variety of reasons, many were not eligible for this earlier funding round. But today's announcement brings them in line with the previous increases that were provided to other residential and congregate care providers earlier in the year. And as we prepare to move forward and bring kids back to school in September, the Department of Elementary and Secondary Education has released comprehensive guidance for special education, including schools like this one. DESE also released extended school year guidance to allow for special education day programs to open now. We're grateful for the collaboration between special education community and the administration and local communities as we all continue to develop guidance and work together to keep students safe and ensure that they continue to get the education that they need and deserve. And we'll obviously continue to work with this community as we go forward. I want to thank you all again for the great work that you've done here in the Commonwealth for many, many years. I had no idea it was 46 years. You must have started when you were about 12. And with that, I'd like to turn it over to Secretary Sutters for more details on this announcement. Thank you.
Governor, Lieutenant Governor, New England Center for Children, your board chair, Vinnie, and the 900 staff. Thank you for what you do each and every day to help educate some of our most challenged little citizens of the Commonwealth, and actually beyond the Commonwealth. I do want to just echo something the governor said, because early in the pandemic, Vinnie texted, reached out, yelled at me or something to that effect, and said in all the years of the school had never, ever closed. And he wasn't going to have the school close as a result of a pandemic. And what did he and the school and the teachers and the nurses have to do in order to keep kids safe, strong, keep the staff safe, and to go forward? And with the commitment that the New England Center has shown for all 46 years, it is a testament to the belief that all children deserve the best education possible, that the staff needed to be safe and free from COVID, and that the school would be nimble in doing everything possible. And really the New England Center, and I want to give MAPS a shout out, really worked them with all of the residential schools in Massachusetts to figure out what they needed to do to stay open, because as Vinnie said, so many of these kids cannot go home because of the challenges that they have. Families would be overwhelmed by them, and the last thing we needed in the Commonwealth of Massachusetts was to have so many special ed kids end up in emergency rooms because they had no place to go. So it really is, it is a privilege to be with all of you today for that. As the Command Center has been working closely with both the Department of Early Education and Care and the Executive Office of Education to safely reopen childcare and to plan for the fall reopening of school. As the governor said, the Department of Elementary and Secondary Education released guidance specific to special education services for the fall. And one of the things that was very important to us, and we had the opportunity as we walked through the New England Center, was that the day school had reopened as of July 6th, which was the first day schools could reopen. And of course, at the New England Center, the day school would reopen. The guidance directs districts to prioritize providing in-person instruction for students with disabilities, particularly preschool-age students and students with complex and significant needs. These students should receive as much in-person instruction as is feasible within the health and safety parameters in effect at each particular time. So even if schools or districts are operating in a hybrid or remote model in the coming fall, educators and administrators must make every effort to continue to provide up to full-time in-person instruction for our special needs students. Districts should also continue to engage with families as they plan for the fall, both for them to provide input and to ensure they fully understand how the school plans to provide special education services. We know that the past few months have been extraordinarily disruptive to students, but the work that educators and parents have done to keep our students with needs, special needs, safe is remarkable, and that's why in part we're here today. As we are now in phase 3 of the Commonwealth reopening plan, last week we updated visitation guidelines for 24/7 health and human services programs, including our special education residential schools. We heard moving feedback from many families ahead of phase 3, which helps shape the guidance as we relax some of the requirements around physical distancing in addition to allowing office visits, including overnight visits, under specific guidelines. I know the last few months have been difficult, and for loved ones and families who had not been able to see them for a very long period of time. We are grateful for your grace and patience throughout this process as we work together to keep students safe and healthy. And just as a final note, as we have been through the command center working with all of our provider community, it was clear when we had rolled out the $139 million for health and human services programs that because of the particular funding of the funding structure of special education schools, that they were not eligible for that. And so this $16 million is our commitment to the special education schools to provide for the relief on top of rates for some of the costs associated with COVID-19. And with that, Governor?
Questions for me or Vinny or Mary Lou or the Lieutenant Governor? Yeah. Well, first of all, I saw a lot of kids and a lot of teachers that were wearing masks and seemed okay with it, which is obviously, from our point of view, a critically important element to school reopening in the fall. I think the second thing I would say, and we'll follow up with your folks on this, there's clearly been a lot of work done here and a lot of thought put into all the issues associated with disinfecting, cleaning, and ventilation. And I think those are all issues from which we may have an opportunity to learn a few things we can incorporate into how we think about this going forward. Yeah, we've never stopped buying PPE. And we are continuing to purchase it, and we talk on a pretty regular basis to our colleagues across a wide spectrum of service providers, both in healthcare and in education and in business, about PPE generally. And I've been asked before how much is enough on this, and I've basically said there is no such thing as enough. And we are constantly procuring for gloves, gowns, and gear and masks, and we'll constantly be procuring, I anticipate, on this all the way through the fall. We work off of sort of a run rate of what the use of this sort of stuff has looked like over the last few months as we think about what the run rate going forward needs to look like. But we're very much in the buying process with respect to that and plan to stay there for as long as we have to. We're not expecting that we're not going to need this stuff in the fall.
Is there anything you've done here that you step up? Is there anything you've done here that you could suggest to the governor, the secretary, the governor? And we did this year and it seems the work this might translate into all the schools.
There's definitely some areas of dealing with your ventilation, and you've read a lot about ultraviolet lighting equipment, which was it was expensive, but not that expensive. This whole building was done for about $35,000 to $40,000, every piece of the ventilation system. But understanding your ventilation system, making sure there is good ventilation, is a definite lesson we learned. In the one residence where we had a lot of people, well, just about everyone got sick, about 9 kids, but there was, we thought, issues with the ventilation upstairs. And so access to fresh air, good ventilation, trying to separate out your ventilation systems as much as possible, so that there isn't much sharing. Obviously, spreading out. The science is pretty clear. There are some little tools that we learned about. We do constant spray disinfecting regularly after school and before school, as well as wiping everything down. There's a lot of measures that everyone needs to take. If you follow the science and you have testing, now that the biggest issue for us, and we're so thankful that the task force provided us with testing and fairly quick results to those tests that we could give right here and drive into the state lab. If we can test frequently, especially with the new tests that only take a few minutes, if we could test our employees regularly, I'm absolutely certain we could stay wide open, contain the virus, even if we got it in one classroom. Frequent, quick result testing is a problem. A national strategy on all of this stuff, which is beyond the purview of the governor, would be really helpful, I think, for everyone. But I would stress that in Massachusetts, where we were hit very hard and early from Italy at the Genzyme, I guess it was, conference, Biogen, look at where we were versus where we are now, and I think that was a massive effort on their part. But there's a shortage of equipment nationally, and we've stockpiled for the fall. The testing is the one thing that would enable us to deal with this every day successfully if we could get more of it. And I know I'm always bugging them about that, but it's a nationwide problem. No, we didn't. We didn't even know about it. When it was first brought up by our facilities director, I laughed at him and said, "Oh, you've been reading about UFOs as well." Then I started getting friends sending me research showed that they were effective. So we installed it probably a month or so ago when we knew we were coming back to this building. We'll install it eventually, I think, in the residences as well. It's just one tool. There is evidence that it works. I think all the ventilation systems have to be looked at carefully.
Well, I think the first thing I would say is that information generally needs to have the usual, who, what, where, when stuff, and then the who to call and who to follow up with. And I think the goal on this is for people either to pursue it through the 211 system or to just go straight online and do it there. But generally speaking, the way we've worked these things on a more informal basis has been if we hear stuff that comes in, we typically refer it to the appropriate colleague at the local level. And that's one of the reasons why when we put the Reopening Advisory Board together in the first place, the Lieutenant Governor included 3 local officials and have been deeply embedded with local communities ever since. I mean, generally speaking, we can establish industry protocols, we can establish sort of statewide guidance, but most of the time, the actual act of following up on issues around compliance, unless there are very particular areas where we're in fact the regulator and the overseer, are going to be done by our colleagues in local government. Yes, we would refer it locally unless it was one of those areas that involved where we were, for all intents and purposes, the licensing authority. We've been in the process, I think as most people know, for the past year of cleaning up all of the backlog issues that were associated with interstate issues around infractions and violations. We took care of the most egregious ones right away and then worked our way through all of the rest of them. And at this point in time, have what I would describe as a system in place that's completely up to date in terms of both what we send out and what we receive in. With respect to issues around the administrative process of some of the appeals and grievances, the biggest challenge we've had there is COVID. And we've used a variety of mechanisms to try to make it possible for people to get those cleared. But I would agree that, until we get to the point where we can really open up completely, there's probably going to be some delay issues associated with that. But from our point of view, the lesson learned on this one was to act on the data and the information, to eliminate the backlog, and then get to the point where we're completely clean and only dealing with new stuff going forward on all that interstate, all those interstate notifications, which still for the most part are being done by paper, which is unfortunate. Yeah. Yeah, I got asked about this last week, and I basically said at the time that I thought a one-size-fits-all approach to this didn't make any sense at all, and that in many respects, different schools, different states, different kids, different status, different positions and circumstances, and that the best way to deal with this would be to let folks work it out on the ground. And the folks at the Department of Higher Education here in Massachusetts submitted an affidavit in support of the Commonwealth's brief. Thanks, folks. And thank you, folks, all of you.